are you? Have we started? Am I on? Can y'all hear me okay? Okay. So for those that don't know me, I'm Lillian Smith. I'm the dean for the college. And I have been frantically thinking, dreaming, nightmarish sometimes about student financial aid since everything started happening with the One Big Beautiful Bill. And so these changes we started hearing about them, and then we've had some negotiated conversations with the Department of Education, not we, on a national level. And so more clarity came through in October and then November, and that's what we're working with now. We have had, as a nation, I use we a lot, but to be clear, there was an open time for comments on the proposed rule changes after the November negotiated conference. And apparently, last I heard, 89,000 comments had been put in by the March 2nd deadline. And all of our, if you are in a discipline that is in health sciences, all of our disciplines and associations on a national level have been advocating about our disciplines within this particular piece of legislation. And we don't know what's going to happen yet. So what we're going to review today is what has changed, okay? What we know's changed. Why are we, CHHS, the most affected college at the university? And we are, okay? What are our enrollment and recruitment risk? What are we doing? And then how you can help. And then I have some questions, we'll get some input, and follow up, you'll be getting a survey probably tomorrow for more, and to have an opportunity to think and to also provide some additional input and feedback, okay? So what has changed? The major impact change is in graduate financial aid. Now, there have been changes in undergraduate financial aid as well, mostly in the difference between a dependent and an independent student's loan levels. They will also be enforcing regulations that have been on the books but have not been enforced in the past, and that deals with covering electives as a piece of our how electives are covered through federal financial aid. So that's going to be interesting. And there are also changes to the Parent Plus loan program, okay? Now the good news on these things, while there are changes, our financial aid office here at WMU and every financial office at every college and university is closely monitoring and on top of undergraduate financial aid, okay? So why am I going to focus on graduate financial aid? Because we are one of the few colleges, and many people will say we're the only college deeply impacted by the changes that have come down, that there is not as much concern, big administration, big A level, about the financial aid implications for our college. We are an anomaly. We're off on, and in some ways, a little bit on our own, right, in how we go forward with this. So, and they are working to keep us up to date on information they get, things like that, but we are also working to be proactive in how we have some level of information and response, okay? So when I say that, that's really our what we're doing ourselves. The big changes are these. There will be no Grad Plus loans at all going forward. After 7-1, there will be no Grad Plus loans. We have always had a limitation of $20,500 for annual graduate borrowing for the non-Grad Plus loans. So we have direct unsubsidized loans that our students can receive and have been able to receive, and they have been limited and have always been limited to $20,500 per year. Per year. Okay, that's all they can borrow per year. So when we have a program that costs nearly $50,000 per year, like PT, then they go out and would get Grad Plus loans to cover the difference. It's a pretty big gap, right? There are no more Grad Plus loans. So we have an annual cap. The annual cap is the thing that bothers us the most. Okay? It is the main problem for us. So graduate aggregate cap is $100,000. So you can only borrow $20,000 a year, and maximum on this, if you are doing one of the academic degrees, is $100,000. If you are in a professional degree program, that is $50,000 a year with a $200,000 aggregate. And I'll show you in a minute who falls under that. And also, there are new repayment assistance programs. So why it matters for us, again, is we have been borrowing up to the cost of attendance. And we have cost of attendance, and we have our programs and fees. And just our programs and fees are already way beyond the scope of what the $20,500 covers, right? Cost of living and all of the things that we're doing. So cost of living across, if you look at our undergraduate cost of living, it's like $18,000, right? And many people will say 18 to 20 something thousand dollars for a year of living, right? In all of the calculations we're doing, we're using $15,000, which is low, conservative. Because what I hear when I tell people that we're looking at cost of living, they're saying, well, can't they sleep on sofas? Can't they double up? I ate 5 packets of ramen. I bought 5 packets of ramen when I was going through college. Can't they do that? Right? So again, as we're going forward, we want to make sure that we're showing that we do have a conservative estimate. We do expect our students to be thrifty, but also I would really prefer that they be healthy when they are going through and doing their graduate programming with us. We also know that in all the studies that we've gone, that nutrition is key to learning, right? And we look at the whole wheel of wellness and financial wellness, emotional, mental wellness, sleeping on sofas and being housing insecure or homeless is not good for our health either, right? And so there are a lot of different issues that we start looking at when we're looking at this. Yes, ma'am?
Can I clarify? So the aggregate cap, is that on only their graduate?
That's only on graduate.
Undergraduate into account?
No, then when you take undergraduate into account, it's 158,000. Okay, so it's 158,500 now, which is a good thing. One of the differences is that we used to have a cap of 138. So when they did the change, there are at least, so if you were to borrow all of what you were able to borrow as an undergraduate, in the past, one of the differences is that actually subtracted from your overall aggregate when you got into your graduate programming. Okay? They've taken that, they've cleared that out. So that was a plus that has come out of some of the negotiations. Okay? Now, the main thing, why are we concerned about this as well, is that, so people also will say, well, can't they just go out and get private loans? They can. Yes, they can. What's the problem with private loans? And a lot of people have gotten private loans, right? And that's the way it is. So when you're in private loans, you have to start repaying them immediately. There's no deferment. So usually if you're in a federally subsidized, unsubsidized loan, you don't start paying until, 30 days, 60 days after you complete your degree. So you aren't borrowing money to start paying back the money that you've already borrowed for your degree. Okay? So you push that out until you complete your degree. Also, no private loans will be forgivable. No private loans fall into any of the other categories we do to help people who are just getting out of college, having different repayment plans, or if you're in public service, being able to have loan forgiveness. No private loans will fall into those categories at all. Okay? So, why it matters to us, none of our degrees within Health and Human Services fall within the professional degree category. Not a one. We only have one within the university. One within WMU. Okay? WMed is not part of us. They actually are not part of WMU. They're an affiliated private. Their degrees are covered under the professional degrees. Okay? Not on one of ours. In this college is and only one overall. All of us fall within the graduate degree, 20,500. Okay? Now, if you want more information on this, this is the only thing that may and or could change. And right now, again, I already said we had 89,000 comments plus that came through. Many of them are about this. Okay? However, I'm not overly optimistic, and I'll tell you why. When they put out the findings, so that we had the October, the November negotiations that occurred, they put out a 330 some odd page document explaining what they considered in coming up with the decisions that they came up with. At least 60 of those pages are dedicated as to why they excluded our specific programs. Okay? They have intentionally documented why they excluded our programs and why we should not be considered a professional program. Okay? They didn't do that for each and every other one. There were probably 20 different programs that could have been included. Our specific allied health, rehabilitative health, social work, public health were intentionally and documentedly excluded. So again, who knows? We may come to the end of March and they come out with something that says that we're all included. Who believes that, right? Yeah. Holding your breath? Anybody holding your breath? And we will know by the end of March, supposedly. So that's the timeline right now. Because this stuff starts 7/1. Okay? This starts 7/1/2026. This year. In 4 months? No? Yeah, 4 months now. 3 months. 3 to 4 months. Okay? So, why are we the most exposed? So why is this the greatest problem for us? So we've been doing a lot of analysis, been taking all this information, we've put it into big spreadsheets, we've got all this stuff about when our students take how many credits within each of their programs so that we can figure out what one, and we call them a rise year. You have a rise year. Rise year equals $20,500, right? And rise year starts summer 2, fall, spring, summer 1. Rinse, spit, do again, right? So, yes, ma'am.
Lily, can I just say, for people that are maybe thinking about this from a personal perspective, that's unique to Western, summer 2 as a start, right? So one of the things that we learned in our conversation is that at some institutions, the summer 1 session is the header, but at Western, the summer 2 session is the header. So if you're thinking about this information personally, you'll want to find out that information.
Yeah, you'll need to go and you take a look at whatever. If your kids are going to another institution, you need to go take a look. Yep.
And from what I've read, you have to have had a disbursement from the Grad Plus Loan Program prior to July 1st to be grandfathered.
Yeah.
If you have not had a disbursement before that date, it's gone.
So what she's saying is that you do have the ability to be grandfathered into Grad Plus loans. So our students can get Grad Plus loans if they start a program, if they are in a program prior to 6/30 and they have had 6/30/2026, the end of June, and they have had a disbursement as well. And so why that matters for us. If we were to start summer 2 a week before, and we talked about this. This is one of the things we tried to do. If we started it a week before, they would actually not have dispersed the federal financial aid, regardless of when we started summer 2, until 7/1. Okay? So we were doing all kinds of gymnastics trying to figure out how to do this for this first year, okay? Because it's happening quickly. That was not going to work. So that's why. So our students do have the ability, if they are currently in programming, if they're already in our programs, our continuing students will have the ability to just chug along with what they're doing currently. And it does not impact our students who are in current programs who currently have had a disbursement. If they were thinking they would start Grad Plus in year 2, 3, they need to have it now. Because if they haven't gotten a Grad Plus loan, if they have not had a Grad Plus loan before 6/30, they are not eligible next year, regardless of when they started their program. Okay? You can see it gets a little complicated. And it gets really confusing to our students and the parents. Okay? Yes, ma'am.
So if I'm understanding correctly, the 20,500 is sort of like the initial loan, and anything over that is the Grad Plus loan.
Was the Grad Plus loan.
No, but it's currently it is right now.
Yes.
So like for OT, they are offering one class in summer 1, and they are asking their new students, if they want to do that, to be a part of it. So does that mean that their tuition bill, since it's just one class, has to be over that 20,500 and they take a Grad Plus loan? If they don't need a Grad Plus loan to cover that one class, that one semester, are they still grandfathered in?
They would have to take out a Grad Plus loan if they were going to do it. And there is proration. So they can only, it will be, so the amount that they get, which this is one of the things they're still figuring out, it will very likely be prorated for that one semester 3-credit class. So they wouldn't have to take out the full 20,500. They would be capped because of the proration, right? And then they could take the Grad Plus loan. And they would need to take the Grad Plus loan if that's why they're starting early and they need Grad Plus loans.
So that clarification needs to be made.
Yes, that
So
clarification.
They can't just take $6,000 or something. They have to make sure that they like check mark box or whatever that they need the Grad Plus.
That they need the Grad Plus loan.
Okay.
Yep. Yep. That is an important clarification. Again, that's why we wanted to have a good conversation about this, because these are going to be the kinds of questions that we're going to be hearing. And we want to be very clear with our folks as we're going through this or as clear as possible, right? I mean, Amy and I, you know, we're up talking about this stuff all night most of the time, and sorry. So Amy's on a committee with her association, and so she's a little bit more in and active on that national level. So I'm getting a lot of information from her as well, right? So we're going to going back and forth. But the whole idea of proration, how that works, how do we actually estimate our cost of living expenses here? We've actually not been doing that for our graduate programs. So our students have not been borrowing a ton of money, because the only thing they've really been taking into consideration has been the actual expenses of the program. So in some ways, it's a blessing, right? Borrowing this much money on a regular basis is not a great thing. I mean, being able to borrow $50,000 a year to do your graduate work, I'm not, the only reason I'm sorry that we're not in that category is because it will keep people who do not have the means out of our programs. Okay? But having people with that amount of burden on them when they graduate, to me, is not a great thing. Okay? Yes, Scott?
Early on, it had been determined that if, even for students who were grandfathered in, if at any point they had to take a semester off or stop out, they would lose that grandfather.
They lose it. That's still the case. Still the case. So they have to continuously stay in their program to stay in what's called a legacy exemption. It's called a legacy exemption. Yeah. Yeah. So, and understanding that and this is also important to realize what our students are doing. So for all of our students to actually have gotten Grad Plus loans, we were borrowing the full $20,000 a year. Okay? It isn't that you just decided to get Grad Plus loans and you didn't take the $20,000. You had to take the full amount that's allowable for you to take to be able to be eligible for Grad Plus. Okay? So, what is this going to look like for us? Why are we concerned? So we're already hearing things like, holy cow, how can I afford this? Already have heard, I know I've had a couple of faculty, I'm looking back at Maureen, who's had people already tell her, young students say, I can't afford to go into these programs. I'm not even going to put in an application, kind of thing. So what we know is that physician assistant, only because they get 1,500 applicants a year, they have a deeper pool than any of the other programs. And it's still a concern. 100%. 100%. They're also the highest users of Grad Plus loans. 65% of their students, 68% of their students took Grad Plus loans. 68, yeah, somewhere in there. Took Grad Plus loans. More than 2/3 of their students were relying on Grad Plus loans to be able to do that. So we're talking about going deep to be able to make sure that they're going to fill a cohort.
That applicant pool thins out pretty quick.
Yep. Yes, ma'am.
I don't think it's just the sheer number. I think it's also the students that we're attracting. So I think there's we should all have a big concern about fewer first generation students.
Oh, yeah.
Fewer students of color. So it isn't to me just the sheer number of applicants, but it's who are those applicants, and I think we're going to see the face of our students change.
I think it's a huge risk for us. Absolutely a huge risk. This will also be so physical therapy. We're already seeing a decline in applicants. So that's a concern. And why is this? Why, guys? We're already hearing. When I'm going out and talking with community people, even from people going into our undergraduate programs, they're saying, but we can't afford to do that. This is now outside of my horizon. Okay? Go to Southwest Michigan first. Outside of my horizon. This is what they're hearing when I'm talking to Kalamazoo Promise. Outside of our horizon. Okay? It'll have a huge impact for us. All of us here are at elevated risk. We already had small pools of applicants. And because of many things, you're not necessarily small pool of... Okay. We'll move you back up. Okay. That's why we have conversation. So, small pools of applications, and at the same time, we're in the demographic slow roll hill. We don't necessarily call it a cliff anymore because it doesn't just drop off. It's a slow roll downward hill. Okay? We have fewer students coming out of high school than we did before. We can't change that. We can't go back and have more babies, right? So it's a demographic problem for us, and we are not, as a state, recruiting enough young families into the state to make up the difference. There are some states that are not impacted because they're getting all of our folks, you know. But we are one of the top 5 states. And the person that's also a top 5 state is sitting right next to us and where we recruit most of our out-of-state students, which is Illinois. So we got 2 of the top 5 states that are losing people in this population in the undergraduate, coming into undergraduate population. And where we recruit most of our out-of-state is also top 5. So, what are we doing? And let me just go back to say, when we look at overall Grad Plus loans across this university, over 65% of those Grad Plus loans were from our college. Across all other colleges, this is from the financial aid office, and they give us those statistics. The average for our college was 30,000, I don't want to exaggerate. It was 28 something. 28,000 something was the annual average for our college for Grad Plus loans. Mm-hmm.
Just in the back of my mind with things that were talked about last year and the beginning of this year with monies coming into the CHHS versus other colleges. Have you guys looked at how that has affected, I mean, if more of our students had graduate assistantships, they wouldn't take out as much in loans. Has that comparison been made?
Oh, yes. So I can tell you. $13.5 million are set aside, are allocated for graduate assistantships at the university. That's about $13.5 million, and we get $450,000. We get 3.3% of the money that is allocated for graduate assistantships. Okay? We generate more than 25% of all graduate tuition. Yeah, it doesn't make sense to me either. No, doesn't make sense. Doesn't make sense. So, no, I am heavily, heavily, heavily advocating. Those 50 additional GAs up there, that's my ask to the provost office. Those are 1.0s. 20 hours. Yep. And my ask to the provost office is 12 months. Yeah, because our students are here 12 months, right? So that's my ask. Now, they laughed when I asked, but I'm asking. And I gave it to the president. And I'm asking again. And I bring it up every chance I have. People keep telling me, Lillian, that's not going to happen. And I said, well, if it's not going to happen, then it will be because you are sick and tired of hearing me and have killed me. Because I am not letting this go.
I would like to hear it, it doesn't have to be right now. I had an assumption, and maybe I was wrong, that many of our professional programs, the students didn't have time to be graduate assistants.
That's
Are
the thing.
we gonna get to the point where they might have time? Because generally, I've used someone from another college, and obviously that's not a good thing to do.
Yeah. Jan, that's a great point. And that's where we get into this.
You can use other programs within our college though, because our students can't hold an assistantship as we stand right now, but working for us, right, it's against accreditation standards, but you can look at OT or PT or any other.
Again, I just don't know if you as leaders of the program think that's good for them or not. I
Well-
mean, obviously now it's a different scene.
And I think that is a particularly great question and why we wanted to have a conversation. Because these are things that I've been asking our chairs and directors to bring back to their faculty to think about how do we create space? How do we create space in our highly accelerated programming for our students to be able to take a 5-hour, maybe 5-hour work once and or twice a week? It makes a huge difference when we start modeling out what a graduate assistantship does. And I can ask for these, and I'll tell you who's going to be able to use them right off the bat. You got it. Social work. OT. OT has more space, not as much as social work. But also our graduate certificate programs in SIP also have more ability. The other folks, in blind low vision, we would have probably some in the more traditional speech, language, hearing, probably have some more ability there. And there's also, we also are looking for some clarification because, Shannon, one of the things that you just said, our students can work for us. Your PA student can work for us. And what we're asking, we've asked Powers Law Firm to give us clarification. We're working with attorneys in Washington to give us clarification on what our students can and cannot do as we are looking into solutions, right? So we're looking into these solutions, what they can and cannot do. We cannot, in PA, we cannot ask them to work as part of their program. Okay? We cannot, and this happens all the time, right? We get one set of accreditation criteria, we get another set of accreditation criteria. Somebody says, oh, we can't do this and we can't do that. And we've got, I think, 8 different accreditation criteria that we're all looking across. So I'm asking experts to look into it from a legal standpoint, what we can and cannot do when it comes to and we just happen to, thanks to PA and our successful beating down of ARC PA, changing accreditation across the United States for PA, but those guys actually have a financial aid attorney that they keep on staff, and they're working with us to help us come up with some of these solutions. Because this is slow rolling out. We got to make sure we're on top. Yes, ma'am.
I mean, obviously by the table here, we see where the greatest need is, but then if we award graduate assistantships based on the availability, because maybe it's a part-time program or 6 credits a semester, that's where the lowest need is compared to 17 credits a semester. We're going to be shooting ourselves in the foot, if we can't draw some into the more expensive.
Exactly.
With the gaps, yeah.
Exactly.
I wonder what the dollar amount is for those 50 additional GAs year round and how that relates to how much we subvent other colleges.
I could actually give you that data if you want to talk to me afterwards. I've got it in my office. Not on the tip of my tongue.
Right,
No, because I've looked at this so many different ways, I've got to tell you. And it's actually quite remarkable. And we are really looking at what the budget implications are for us going forward, right? Because we have a new budget coming in. Yes, ma'am?
Love that you're looking at multiple ways for students to get funding. I would speak in two different ways. One, as a mom of two kids who did healthcare degrees. One had $375,000 in debt, far surpassed what I as a parent could ever help pay back if something happened. The other had $200,000 in debt and something happened. Not her own fault, but and something happened. I don't think more loans, more money given in that way to kids is a wise way
I don't either.
for us to be barking up a tree.
I don't
love
either.
the fact that this conversation is talking about what are other ways to help fund students. One of them that we've got right now is all the accessibility stuff, right? I've got a whole crew of students, 40 will be here this summer, that could be doing accessibility things for all of you guys. We could be meeting that need, right? Many of them are doing jobs as vision professionals already, but so much of it could be done online.
Yep.
The problem is, right? The problem is, it doesn't fit in one of those nice little categories for them to be paid or be given tuition remission or any of those little things. So I love that the conversation is finally going in that direction. We have assistive technology classes that we need a TA for. We need somebody to make sure things are charged and set up and ready to go. I can't keep an instructor for that class because there's so much dealing with stuff that I should be able to pay a student for, but it doesn't fit nicely. And I've asked numerous times and always been told, no, you can't. You can't have somebody from that funding category.
Yep.
I'm like, okay, we
Yep.
actually have something that a student could do that would be of a real value to our program. Could help with what they owe. And because of whatever the restrictions are, what has kept us from thinking in a new way. So I love that the conversation has moved us to think in a new way.
We got to think in a new way. I think that, and honestly, until we got to this point with this piece of legislation, and this will be my only thank you for this piece of legislation, is that it's making us look at how much debt our students were walking out with. Because it's not okay.
Thank you so much for asking the provost and president for the 50 additional GAs. And I'm just wondering, no crystal ball required, what your vibe is on how they're receiving your ask.
Okay, so that is one of my asks. We are putting this up every way we can. So we also have the Huron consultancy going on. So people that are representing us in those groups are talking about this. So we're trying to bring it to the attention of any and everybody that we can. And this is what we have to do, right? We have to make sure that the inequity of that is brought up and that there needs to be, and again, I think I said this last year, in some ways people don't really care about whether or not things are fair or not fair about the distribution of that graduate assistantship money. What's happened is that we have people who are dependent on it and who have recruited students on that money, right? And now we're saying, but what about us? And what we're saying, and we will continue to say, yeah, and what about us? And what about our students? Because our students also deserve a fair break. Yep.
Jan, correct me if I'm wrong, but the provost was asked the question at the Senate about this thing of these graduate assistants. And his response was a little bit different.
Uh-huh.
He said that college, I won't mention arts and sciences, gets $9 million of that because they allocate that for only teaching assistants. Every graduate assistant teaches 2 courses undergraduate every semester, and open to people if that's exclusively what you're using.
I don't,
And that's, pardon?
I don't recall.
So
That's, I asked the question.
I appreciate it. Yeah, exactly. Because we're seeding the question. Thank you. So thank you, Dennis, for asking the question. And here's the truth about that. That a graduate assistantship is the most expensive way to deliver one of our undergraduate courses, right? And it is twice as much, if not 3 times as much, as it is for a PTI. It's about the same amount of money as a regular faculty member. Okay? Yeah, it's ridiculous. Because you're doing, so you got to figure it's about $15,000 per semester, and maybe they teach 2 on their own. Maybe. Here's the kicker.
I didn't say they did, that's what you said.
Yes. Here's the kicker. Many times they're supporting the other, a real faculty member, an AAUP faculty member in the classroom. When I go to presentations and I have a faculty member tell me, say in the middle of this presentation, I always have a TA for all of my classes. Like, what earth are you on? Are you kidding? Why? I mean, and they do. And so that's where we come up with all of that. So if you look at, and Alex and I have been putting together so much data, it's coming out of our ears. So we look at how many sections are actually taught by graduate assistants. It doesn't add up, Dennis. It doesn't add up. And so if they are, in fact, the instructor of record on a class, it does not add up. And they get out of it, well, I'm not even, guys, we've been looking at this every single which way. However, it is bringing up this conversation more and more. To go back to your question, Carrie, what is the vibe, right? We just keep bringing it up in different ways and continually keeping it front of mind. Because, you know, at other universities where I've been, health sciences are almost always receiving the least, almost always. This isn't completely new, but not 3.3%. That's ridiculous. It's ridiculous. And so I'm also asking, you don't have to actually take that away from them, add another $2 million to the pot and give it to us. I mean, there are a lot, it isn't an us or them when we're thinking about this, and people say, oh, the money's got to come from somewhere. And I say, yeah, it does. And a lot of this is, yeah, it is an disingenuous conversation, to say the least. Yeah.
And that's the other thing, so you're talking about the GAs that we lost. We also, with the SRM, lost a significant amount, even though we were only reimbursed a small portion for the graduate tuition we brought in. We also
Yep.
lost, we've said before, more than $10 million in subvention. Have you guys run those numbers?
Yes, and you're right. It's about $10 million over the last 5 years. And that's in some ways how you look at it. We were supposed to have it. This inequity is undisputed now because President Montgomery had a correction to the model that we had already started implementing. And I'm asking them to continue that in the new model. It's undisputed. We aren't asking to get rebased. We aren't actually asking for anything that's all of a sudden new. What we're asking is to get an appropriate amount of graduate tuition. And guys, if I can get, well, I'm not going to say that. I'm not going to say that out loud. Get 1, 2, I'd be good. Yeah.
How many GAs does 3.3% translate to for the CHHS? And follow-up question is, let's say we get this 50. Have you discussed like centralizing it a little bit?
Yeah.
It's because it's very siloed. Where once it's like, how do I get a GA? It's like I know social work just sends out an email to all current students when we're looking for a GA when somebody's about to graduate. So it's like we're only pulling from our pool for our pool, and so it's other departments don't even know
Yeah.
that positions are available, but also we want to support our own students. So
So yep.
Not many.
So one of the things that we've looked at with this is that, so what are the things that we can do? Yes, ma'am?
I guess I just have a question jumping off of that, and it's more someone who did their GA position at a different university. Is it not already centralized between the whole university?
Mm-mm. No.
I know social work just sent theirs out, like, it's just an email that us to say, hey, if you're interested, fill out this application, time, like, and then that's how they do it.
Mhm.
I'm not sure how other departments do it, but
Yeah.
like when I get just if an OT can come to me and says, hey, how can I apply for a graduate assistantship? It's not like it's posted on Handshake or at the graduate college or at CHHS or something like that. There's not a central
Yeah.
office for that.
So what we are looking at, and I think that's a great point. So one of the applications that we sent in, and we're already, I say applications, proposals. We've got a couple of proposals out to different foundations right now. That is to develop a program, really, to develop more programming around graduate assistantship, around scholarship, endowment, all of these things. So braided funding. And this is where, and it works directly with clinical partnerships, is how do we actually get, if you're an employee somewhere, how do we use your money for your, many people have a tuition benefit through that. Can we use that, and or do we need to work with your organization or your system? So for example, some systems will say you can only access that benefit if you work 0.75% of a job. I'm saying, why not 0.5? We did that at Boise. We changed it. We had it changed with one of our systems. And that way, that's like a graduate assistantship. You're working 20 hours a week, and you're able to get your tuition benefit from your business, and you're going there. We are doing a big project right now called the Health Sector Assessment and Pathway Development. Folks, we're working with our industry partners. And we have Bronson, Bill Manns, we have Beacon, Carl Risk, we've got the Jeff Patton with ISK, we have the superintendent for Kalamazoo, we have KRISA leadership, we have, and so Family Health Center leadership, and Paige Egan from KVCC. We're all working together because we think that this could be, with this, a real opportunity for us to be able to do some things together. They're as concerned as we are because this impacts their pipeline. If we're losing them in middle school and high school saying, hey, it ain't for me, I can't afford that kind of profession, what kind of pathway development are we going to be able to do, right? So we're going deep, this is going to be long term, but we do have to think about what we're doing today within our own organization. And so what Jan brought up is a big question. Where is space for people to work? Okay? And so we have to look at that. We have to look at that, and that isn't me looking at that. That's the faculty, those are departments, those are our schools looking at how can we do this better? How can we do this better so that our students are allowed to work? If we're telling people you cannot work while you're in our program and there is no means for you to cover the cost of your program, then we are intentionally leaving out people. And we got to think about that. So how do we actually create space? And one of the things that we're thinking about is within our own clinics. We have our own clinics. We can do graduate assistantship, federal work study, we can do workers, those types of things, using our graduate students as peer leaders, right? And still having normal student workers who are doing work. How do we increase in the clinic where we have PAs in the clinic? How do we actually increase, because I don't need a functioning PA, I don't need a licensed PA if we're doing continuing education. if we are doing case management, if we're doing regular, just clinical administration, working in CDS, right? Having a level of student, if we start really creating opportunities for our students, whether that's graduate assistantship, I'm not asking CDS to pick up the cost of graduate assistantships, but how do we match that money with other money so we create opportunity to be able to, one thing, maybe lower turnover for Don, get better prepared students to work with cognitive disabilities, right? And have a really strong, wonderful working opportunity where people go, that's a preferred job for me. Those types of things. How are we going to do those things? So this is going to be a little bit of us actually looking together to say, you know, are we actually going to be willing to do some changes in adjustment, adaptation to our curriculum to maybe create that space, right? Yeah, sorry.
What I was gonna say, we live in that braided funding model. We started out 100% federal funding.
Yep.
We now have 6 sources of funding for our students, but we have had to change drastically how we teach to meet the students' needs.
Yep.
When students were no longer on 100% funding, then we couldn't just say, you're here, you're ours, you show up when we say.
Yep.
Oh, they had another job to go to. They had kids to take care of. We start taking in a different group of students. We're all non-traditional students at this point, and we've had to meet those individual funders' needs. The VA funding wants one thing, the state wants another thing, and the federal government wants another thing, and the association in Grand Rapids needs something else. So we need to really be flexible, and that has been the most difficult piece, is convincing a faculty member that no, that class has to be taught in person and online, and yes, you need to meet the student's need. It is huge to live this.
Yes, it is.
It's not.
It is
it's
different.
Not just oh, we're going to do some things different. It is
It's-
every day, rubber meets the road, and be ready to meet a student's need.
It's going to be hugely, and it's going to require a lot from our faculty and from our departments in schools. Yes, Dennis?
Doing this, have we exploited, and I see Dr. Briggs down there, have we exploited the unified clinic sufficiently?
We have not, and we will.
We have.
We are going to exploit you. Okay.
I've known it a long time, so have we exploited our students signing up for what I call servitude contracts? Such things as the Army, the Navy, Air Force, Marines, pay you in a number of our disciplines to go through your program. You owe them year for year, and they'll pay you during those extra years. Indian Health Services has that.
Yep.
Other places. We've got our buddy here. I'm pointing to him.
Yep.
From rehab, right? Have we exploited those at all and got people to sign up for them? I mean, not everybody wants to be, I was in the Army, you don't want to be in the Army. But if it means you get through the PA program,
Yep. So
I change my attitude.
one of the things we are looking at, and I think that's a great suggestion. I didn't have that on the list. That's why we're here, right? We got about 5 minutes, so I'm going to just. One of the things we are absolutely looking at is service to industry partners. So we had Beacon come up and say, so if I have somebody who's, and so where is that going to be fun? Is it their existing employees who may or may not get into our programs? Or are they saying they're going to take one of our students and then have them start working there and then sign the contract that says, I'll pay for everything as long as you work for me for 3 years. So there's a little bit of, we still have to work that out. And again, that comes down, this is going to be a partnership, guys. This is all hands on deck. All hands on deck. Okay?
I'm just wondering about how much the
nothing about graduate.
No, we have set up our own webpage on the college, and so being aligned with each other, no, it is. It's a huge problem.
Right, I don't understand why the university doesn't put graduate education on the front of their website. But right now, it says you can either be an undergraduate student or a certificate student for SPEA. Other than that, you're not eligible.
Yeah,
And
yeah.
it's the front page.
So we were looking for a document that Amy had found. We were in my office, and we had to search unsuccessfully for a few times the web to try to come back to the page that actually talked about the limitations on graduate education for the university. So it's a problem. That's a problem. We're continuing to work with them.
The 4+1 curriculum
Mhm.
for OT, how it used to be, and then it was only 30 graduate credits. Like, is that an option to recruit from undergrad to grad and maybe give them a bridge year? But I don't know how the new standards or the new requirements
Yep.
would impact that.
Yep. And so that's still working out. If you are taking courses for an undergraduate degree program, it's going to apply to your undergraduate degree. But if you actually then convert them into a graduate degree, that's still kind of a, they're still looking at that. So as far as I know, I have not seen clarification on that. That's a great question, though.
You said they're still looking at that. Is that institutionally or part of the bigger picture?
Bigger picture. They as in, I'm sorry, thank you, Mark. They as in the U.S. Department of Education and the committees that are looking at all of this, okay? They are still looking at it. So we want to stay aligned, and we need to hear what you're hearing. So be talking to your department chairs, directors, talk to our advisors, advising team, Scott and Neil. We'll also set up a general way for you to be able to send in comments, but we're also going to send a survey out. Okay, again, the survey is going to be asking you, so you can see we've got questions, and we've run out of time because it does raise a lot of questions. Like, are we looking at these things? 4+1s, 4+2s, 3+2s, 2+4, you know? You got all kinds of different ways to look at different programming. And again, we need to get coordinated on that. What are we already hearing from students? And we are already hearing from students. So we're going to ask you that. If you've been hearing from students, I want to know what you're hearing. That gives me more information. It gives me more when I go to the president and the provost and our upper administration to say, these are the things we're already hearing. And honestly, because of that, that's why they're starting to pay attention. You know, we have students that are going out, they're getting accepted to 3 or 4 different programs, they're putting in their deposits, and then we don't know what's going to happen. We've already had 1 or 2 pull out, go someplace else, right? So we know that that's going to happen. We know that that's going to happen. They're waiting to get their financial packages, and they're going to take the best option for them. And while I want them to come here, I also want them to have good financial health.
And I would say too, my daughter's at this age right now, or in grad school next year. I was shocked at her friends that have no idea. So I'm afraid there's also going to be a surge at the time enrollment's supposed to start because they were clueless that any of this was happening.
Yeah.
So there's a lot of people that are very unaware yet.
Very unaware, very unaware. And so again, we want to make sure we stay aligned, we give appropriate information. We're going to want to send people to the CHHS website, not just the general website. I know that sounds a little wonky, but for our graduate programming especially, we've got much clearer. I mean, I looked at our own at the university website, and I was like, what does that mean? And I sleep, eat, work this, okay? And I didn't understand what it meant. I had to ask a clarifying question to Shoshanta and say, what does this mean? If this situation occurs, what happens? And anyway, so while it's still coming down, there's a lot of room for misinterpretation. There's a lot of room for poor information. So please just recognize that. Recognize that within your own self. Let me check on things. I really appreciate you saying this to me, you letting me know you're concerned. Let me put you in touch with the right person. right? Instead of just giving information we think might or might not be right. We're going to send out the survey because we need more information. I was afraid this was going to happen. So we have the survey as the follow-up to make sure we get your input, okay? And I really appreciate everybody being here. This is critically important for us and for our students. And also, I'm very, as you can tell, I'm very serious and passionate about this. I'm also very much believing that we can innovate our way out of this and get our students to a better place walking out the door. I think we can. And so I remain hopeful on that front, that we will come up with solutions, that we will come up on ways that actually in the long run end up being better for our students. Okay? So I leave you with a bit of hope, but also knowing this is serious and we got some work to do. Okay?
When are you going to have the survey results back out? Because disseminating information is a good idea.
No, that's great. So we'll get the information back. We can get it back out by next week, early next week. Okay? Okay. We're going to be asking our chairs and directors to start working with our faculties to start really thinking through some of these questions and issues, right? Because again, there's only so if I can go out and get the graduate assistantships, they have to have the ability to work. They have to have the space to work. So that's got to come from somewhere, and I can't make that. Okay? Okay, guys, thank you.